Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy, and tonsillectomy and adenoidectomy are a very common procedure that's done to help with recurrent infections, snoring problems, tonsil stones. Those are the most common reasons that we do those, and occasionally for some other things. But if your child or you yourself needs to have your tonsils and adenoids removed, I just wanted to go over a few of the expectations and things that are good to know. The surgery takes about 20 to 30 minutes to do. It's done under a general anesthetic so people don't feel any pain while the surgery is going on. Now, after you wake up from surgery, you're going to have a pretty bad sore throat. The sore throat is most severe over the first week, but it's still going to be around the second week, and in adults, even into the third and fourth week, they can be a little more sore. Adults typically do have a rougher time in recovery than children, but it's still something that adults and anyone can go through safely. The surgical risks are primarily bleeding. So after the tonsils are taken out, we have these raw areas where the tonsils used to be. And although we cauterize those vessels after surgery, sometimes the scabs can come off prematurely and people can have bleeding. And it's hard to predict when and where and why that's going to happen for folks. Now, after 14 days, if someone's had no bleeding, then they really don't have to worry about that. The bleeding risks are going to be only over those first 14 days. Because of that, we like to have people refrain from extraneous physical activity over those days. So after surgery, the most important things are to drink plenty of fluids. That helps reduce your chances of bleeding and helps you feel better. If you don't want to eat after surgery for a while, that's okay, because you're going to make that up as soon as your throat feels better. But you have to drink. In children, sometimes they don't want to drink well, and occasionally if that gets bad enough, they may even have to go to the emergency room and get IV fluids, and so really want to encourage lots of drinking. Now afterwards, you always hear about ice cream and popsicles and things, and those things are fine, but sometimes things that are more body temperature or lukewarm feel better at first, and then try transitioning to things that are either warm or cold depending upon the person's preferences. Now, water's great. Electrolyte type solutions are great, but any kind of liquids are okay. So whatever that child will take to get them through that period is going to be acceptable to me. If you do have a little bit of bleeding and it stops on its own, that's okay. Just kind of keep a very close eye on that. But any kind of excessive bleeding needs to go to the emergency room to be evaluated and treated. So if there's any issues or problems, you can always give us a call at 803-936-7530. Thank you.